Following abdominal surgery, the patient complains of mild incisional pain while performing deep breathing and cuffing exercises. The nurse's best response would be: Option A, pain will become less each day. Option B, this is normal reaction after surgery. Option C, with a pillow, apply pressure against the incision. Option D, I will give the pain medication the physician ordered. The answer is option C, with a pillow, apply pressure against the incision. Hold the pillow tightly his or her incision when they need to cough or sneeze, because pillow will help to lessen the intra-abdominal pressure created by coughing, which causes tension on the incision that lead to pain. A 75-year-old patient complains of pain. The nurse needs to carefully assess the pain because: Option A, older people are expected to experience chronic pain. Option B, older people have decreased brain perception. Option C, older people experience reduced sensory perception. Option D, older people have altered mental function. The answer is option C, older people experience reduced pain perception. The response of pain in the elderly may be lessened because of reduced acuity of touch, alteration in neural pathways, and diminished processing of sensory data. Mr. X postoperative signs are blood pressure of 80/50 mm of Hg, a pulse of 140 beats per minute, and a respiration of 30 breaths per minute, suspecting shock. Which of the following orders would the nurse question? Options are: Option A, put the patient in modified Trendelenburg position. Option B, administer oxygen at 100%. Option C, administer injection pethidine 50 mg fourth hourly. Option D, monitor urine output every hour. Answer is option C, administer injection pethidine 50 mg fourth hourly. Injection pethidine is a narcotic analgesic, can depress the respiratory and cardiac function, so that injection pethidine is not given to patient in shock. What instruction should the patient given before undergoing a paracentesis? Option A, NBA 12 hours before procedure. Option B, empty bladder before procedure. Option C, strict bed rest following procedure. Option D, empty bowel before procedure. The answer is option B, empty bladder before procedure. Paracentesis is a procedure to remove ascitic fluid from the peritoneal cavity through a puncture made below the umbilicus. The patient needs to avoid before the procedure to prevent accidental puncture of distended bladder during the procedure. A 50-year-old construction worker brought to the hospital unconscious after falling from the top of two-story building. When assessing the patient, the nurse would be most concerned if the assessment revealed: Option A, reactive pupil. Option B, a depressed fontanelle. Option C, bleeding from ear. Option D, elevated temperature. The answer is option C, bleeding from ear. Bleeding from the ear occur only with basal skull fracture that can easily contribute to increased intracranial pressure and brain herniation.